Come in.
Hello, my name is Bianca and I'm going to be your student and I'm going to be your nurse today. And I was wondering if we can do a neurological exam, if that's okay with you.
Yes.
Alright, so I'm just going to be assessing a few things. And first I'm going to start off with, can you tell me your name?
My name is Alessandria Garza.
Alright, and can you tell me what you're doing here?
I'm at a clinic.
Okay, she's at a clinic. Can you tell me the date?
Today is March 20th, 2020.
Alright, and what was the last thing that you had for breakfast?
I had eggs and beans and tortillas.
Okay. Patient is awake and alert, ANO times 4. Alright. Now we're gonna assess your affect, and affect is appropriate for the situation. Right. Okay, we're just gonna turn this way. Patient's speech patterns and content is appropriate and level for the situation. Now I'm gonna assess cranial nerve 7, and I'm gonna have you smile for me. Good, frown. I'm gonna have you wrinkle your forehead. Great job. Alright, now we're gonna assess. Now we're gonna assess cranial nerve 8. Now we're gonna assess cranial nerve 3. And I'm gonna test your pupillary reaction, okay? Alright. Okay, pupils were equal round and something bilaterally. What's the word? We're gonna do a lot of editing here. Pupils were equal, round, and reacted to light bilaterally. So now we're gonna check for extraocular, which is cranial nerve 3, 4, and 6. So I'll have you follow my finger. Okay. Movements are smooth and symmetric in all 6 directions, and there's no nystagmus. We would assess cranial nerve 2 by doing the Snellen chart, which would be letters, and that's for distance. And then we would also be doing the Rosenbaum chart, which is numbers, and that test near vision. And then we would assess peripheral vision by covering one eye and coming into the distance like this. Cover your left eye for me. Tell me when you see my finger.
See it.
Got it. Alright. Now we're going to assess your ears and hearing acuity. So I'll have you stand up for me, please. And then face that way. Alright.
Glasses.
Good job. Alright. And that was to assess cranial nerve 8. Patient is able to repeat 2 syllabus word after hearing a whisper. Then I'll have you stand up for me again. And we're going to test your equilibrium with the Romberg test. Please put your feet together and close your eyes. Alright, minimal swaying. Now I'm going to assess the external ear for redness, drainage, or swelling, and it's all good. Alright, now I'm going to test your nose. I'm going to have you close one nostril and breathe in through this one. Alright, now close the other one and breathe in and out. Alright. Patient can breathe out of both sides of the nostrils bilaterally. Septum is straight and not deviated. There is no nasal drainage present. And then I would assess cranial nerve 1 by having the patient close their eyes and by putting something for them to smell. And see if they can identify the scent. Now I'm going to assess your buccal cavity. Can you open your mouth for me? Alright, buccal cavity is pink, moist, no lesions or masses, and then I'll have you smile. Alright, patient has 32 teeth, and the gums are pink and moist. There is no lesions or decay. I'll assess the patient's tonsils. tonsils are pink, moist, 1+. There's no redness or swelling or exudate on them. I would assess your uvula and palate motion on phonation, which is cranial nerve 9 and 10. So I'll have you open your mouth and say ah.
Ah.
All right. Uvula is pink, moist, in the midline, and moves up and down symmetrically on phonation. I would assess cranial nerves 9 and 10 for the gag reflex by using a tongue depressor, and then sticking it towards the back of their throat and seeing how their gag reflex is. And then I'll give them water to see their ability to swallow, and see if there's gagging, coughing, or choking. Then I would assess tongue movement, cranial nerve 12. So go ahead and protrude your tongue for me. Go up, down, side, side, and then I'll have you poke it out on your cheek like this. Good job. Tongue movement is symmetric and smooth with equal bilateral strength. Then I'm going to assess the ability to clamp jaws, which is assessing cranial nerve 5. So go ahead and clench your jaw. Do it again. Good job. Her masseter muscles contract equally bilaterally. Okay. Patient's muscle tone is equal and appropriate for weight. Tone is also equal and symmetric. I would assess cranial nerve 11 by having the patient move your head side to side. And then could you move your shoulders up and down for me, please? Good job. Movements are smooth and strong bilaterally. There's no present redness, swelling on joints. And then I'm gonna have you walk to the middle and then walk back, please. I am assessing the patient's gait. Weight is evenly distributed. Toes point straight ahead, posture is erect. All right. So it says faculty's choice. I don't know what we're supposed to do here, but I'm gonna have you flex your elbow. So going in, go out with your elbow, go to pronation, supination. Good job. And then I'll have you with your knee do flexion and extension. So go ahead and flex your knee and bring it back down. Good job. And thank you for your time.
Okay.